So as I suspected, and as the doctor just diagnosed you, Diana, you have juvenile periodontal disease.
And what is that?
It's a disease that's genetically involved. So her at-home oral hygiene is great. She brushes when she needs to. She flosses when she needs to. She uses her mouth rinse. But unfortunately, she couldn't stop this from occurring.
Aww. Sweetie?
Yes,
pay attention.
Mom.
Your health, not mine.
I'm listening.
Really?
Generation Snapchat, right?
Yep.
I mean, one day.
You want to be in my picture?
Oh, that's a funny filter, actually. But one day, Diana, seriously though, you might not want to be Snapchatting and putting these selfies if we can't stop this or slow down the progression. You might lose a tooth or a couple of teeth.
But I'm brushing my teeth.
I know, it's not your fault.
Flossing.
You have no control over that from it happening. It's genetically involved. Do you remember or recall anybody in your family that perhaps had this disease or lost teeth during puberty?
I think so. One time my brother made my mother laugh a lot and her two front teeth fell out. She told me that around the age of 12, I believe, she lost them and she's not sure how.
So possibly that's exactly what happened, is that she had it and now Diana unfortunately has it. And the only thing we could do from here on out, Diana, repeat to me, what exactly am I saying to you?
I lost bone. I'm
Okay.
going to lose my teeth.
Okay,
Even though I brush my teeth.
Yes. Now, do you want to help, as a team, you and I and your mother, slow this progression down of bone loss? I can't promise it'll completely stop, but we can slow
but I'm
down.
brushing my teeth, so.
But I'm gonna actually show the both of you. I'm gonna demonstrate it to you today and have you actually practice with me before you leave the office today. I'm gonna recommend an automatic toothbrush, and then as well, I'm gonna use, flossing, because your pockets and your front teeth and then your first molar area are about 5 to 7 millimeters deep. Between toothbrush, flossing, and mouth rinsing alone, you're probably going to reach about 3 millimeters.
Ugh.
So
Anything that can go deeper, like a fluid?
unfortunately, that's why you're going to have to be on top of coming in routinely for your dental cleanings. And I'm actually going to recommend you to see a specialist. I want you to see a periodontist. He specializes in periodontal disease. And a lot of times what happens is we see a patient with periodontal disease every 3 to 4 months. So I'm going to have you go visit him, have a consultation, maybe have your next cleaning with him, and then maybe a couple of cleanings with him. And then from there, if he feels like, it looks good, it's not getting worse, we'll start alternating. So you'll see him one appointment, you'll see me another. What is a periodontist?
Diana, feel free.
I'm quizzing you.
Someone that cleans teeth.
Diana, please feel free to put your phone away, or else I will join Snapchat and send friend requests to all the people on your list. How does that sound?
Ooh. That worked. We don't want that.
It's alright, keep going.
So I'm going to grab a couple of things right now that will help, maybe motivate you to brush longer or, get areas a little better to remove any of that biofilm or plaque. So be one moment, I'm just going to get this up ready. We're going to practice on this Periodontal. Just a fake mouth, okay? So I'm going to have you show me first how you're brushing at home with this manual toothbrush. You kind of got it, but may I show you now?
Yeah.
Okay. So what you're going to do is you're going to take your brush, either if it's going to be an automatic or a manual, and you're going to place it at a 45-degree angle. Have some on the gums, in between the gums and on the tooth. Vibrate just how you were, so you were almost there, but instead of going upwards, we want you to go downward, okay? So you're going to do it all around, 2 to 3 teeth, continue, so on. When you get in the inside here, because especially on the anterior, which are these teeth, which are the front teeth, these teeth, and then your first molars, which is the first big tooth closest to the front of your mouth, okay? Those are the ones that we're noticing the bone loss on. And it's rapid. So your last appointment that you had with me 7 months ago, radiographically, you didn't have this bone loss. So it's gonna happen quick, okay? So we wanna make sure we're on top of it and we're trying to get you in here, recall appointments as soon as possible and brushing properly and taking care of your oral hygiene. Same thing, inside you're gonna use the heel. This is the toe, this is the heel, okay? Vibrating the same thing and sweeping out, okay? So I want you now to practice. Good. Beautiful. Okay, and do the inside.
Is it open? Yeah, I thought it was closed. I'm sorry.
Good. Vibrate a little more before you sweep it. Circle, circle. Beautiful.
Yeah, that one.
So now, this is a manual, which is fine. You know, it's a traditional way. But now we have automatic, which you might actually like and prefer. It's a little more fun to use. So here I have a sonic care, okay? And it has different setting modes, but we're gonna do clean and gum care for you, either of your choice, okay? So what you're gonna do is same thing. See, the toothbrush does the work for you. So you don't have to be in there scrubbing so hard and, you know, just place it where you need to at the correct angle and just let it do its job, okay? Here, I want you to try, Diana.
Okay.
Do the same thing as with the other toothbrush with this. Beautiful.
I
Great.
never thought about investing in a toothbrush like this.
Oh, they're
until now.
wonderful. You just gotta make sure they're charged. And the only thing is I notice a lot of patients say or complain about, really the only thing is it takes up a lot of counter space in the bathroom. That's pretty much it.
I can see that. So,
Oh,
what
good.
else can Diana
Was this
use?
fun? Is this better? Would you,
Yes,
you can
I
see
really
yourself
want
using
that.
this? You want this?
Can you please get me out? That's
Yes.
less work I have to do.
But what else can Diana use?
So as well, so I was saying flossing, which we'll go over a traditional floss first because that's always an amazing, the best method used.
Okay.
But they also have now where they have water pick. So it's basically, you know, in between your teeth, it squirts out fluid,
No.
water, mouth rinse if you choose, and cleans the sulcus area, the pocket depth a little more. But let's go ahead, where is it right here? So here you go, Diana.
I think actually you might have showed me this last appointment. Do you mind?
Yeah, of course. Here, we're gonna have your mother practice. Oh, that's all we have left. Perfect. Look at that.
It's all right. We can get a new one afterwards. So I believe you mentioned wrapping around the middle fingers for dexterity and then using your two pointers?
Correct.
Well, pointers and thumbs, that is. And seesaw in.
All right,
Wonderful.
Diana, so it's your turn now. I want to see how you've been flossing at home with traditional floss. I'll hold the model for you. Anywhere you choose. Okay, when you do the molars here. Wonderful. So you're going to seesaw in, okay, as your mother just said as well. You're going to avoid that papilla, which is the gum here that points out. When you come in, which I'm going to show you now. Be careful. Let's see. Let me see it now. Do you mind holding this for me, please? Thank you, Diane. To start from one end, wrap, not too tight because of the circulation. I'm sure you've had that problem. Okay.
Yeah, that's why I don't like flossing too much.
But that's why, you know, just keep it loose. I'll show you, and then we'll have other methods you can use to floss and get in there, okay? Okay, so basically you're going to go in, seesaw gentle, and before you just go down, once you get in, Diana, you're going to come in and you're going to C-shape, and you're going to go up and down. Come to the next side, up and down.
What was this water pick you were talking about?
So now I'm going to introduce to you the water pick. I mean, there's several types on the market, you know, but this one we like to sell here at the office. You fill it up with water. Some use mouth rinse. You
Diana,
fill it up.
remember the Snapchat threads?
Diana, would this make you wanna? This might be a little more fun as well for you. Okay. I know it sounded intimidating. I know. Don't worry. At least your mother will hear you if you're in the bathroom actually using it or not.
It means
So,
I won't have to check
I'm
up
gonna
on
take
you every
this.
single hour.
Correct. So here, you have on and off. Very simple, okay? You're gonna turn it on. You have it on the low, this is the low setting, okay? Water will shoot out from the spout here, okay? All right, so you're gonna go to your gum line, sit there, let it go in between, right where you would put the floss, okay? And then you're gonna, Diana, you're gonna circle the tooth, okay? I just want you to try now.
Oh, that's a lot easier.
And guess what, your fingers, they won't go numb. But you still have to use traditional floss as well.
It's certainly more entertaining, if you ask me.
You like it?
Yes.
You prefer to have this as well
Yeah,
to help?
I don't have to floss.
Anything at
them.
this point, if it's willing to make her even be more great at home with her oral hygiene, I would recommend it. Now, the only thing is, of course, these products cost a little bit more money.
Understood.
But at the rate of what she's going, and it's a rapid disease, I would highly recommend her having these at home as an adjunct to floss, brushing, mouth rinse.
Understood.
Okay, I'll take this back from you. Diana?
Can I take a selfie?
Sure. So we need you to make an appointment, like I said, on the way out with the
Understood.
periodontist. He's actually here. We're multi-specialty practice. So he's actually here on Thursdays.
Understood.
Okay. Then we will go from there.
Okay.
And yeah, that's it. So
Wonderful.
can you guys explain to me a sum up of exactly what I said today? I really want to hear from you, Diana, to make sure that you fully understand, because you've been on your phone a little bit. So I want to make sure that you understand what's happening to your health.
So I am going to be losing bone if I don't really take care of my teeth, right?
Correct. Well,
And
it's not only your
unfortunately,
fault, but we have to as
We
a team.
can't do anything about it. It's familial. Is that what you're saying? It came from my family?
Correct. But we can, like I said, slow down the progression of the bone loss. You don't want it to get greater, because the more bone you're going to lose, obviously the more teeth that will be lost in the process.
Okay, well, I'll just keep on brushing and flossing like I always do.
And
With
make
the
sure.
new items that she recommended.
Correct.
Yes,
And if you guys have any questions at all, seriously, you're using it, you want to know anything about it, just give the office a call. They'll put me right on the phone and I'll explain it to you so you guys are comfortable with using it. Don't hesitate,
If you
because I know these are new products.
If you could give me tips on how to stay off of your phone, that'd be wonderful. You're
Good luck with that. I can't promise that one. So that's it.
Thank you so much.
Any other questions?
No.
Nothing else. That's
Thank
it,
you for
okay.
everything.
All right.
Open up your eyes. You must have confused me with. You must have confused me with. There ain't no excuses there. 'Cause your mama raised you better.